For the second straight day, India has reported more than 3 lakh COVID-19 infections. That is the highest reported by any country in a single day so far. From 1.5 lakh daily cases on the 10th of April, infections have doubled in the last 11 days. The US crossed the 3 lakh cases mark just once in January. India has seen 3 lakh cases for 2 days in a row. The daily death toll now stands at more than 2,200 just a week ago. Daily deaths were just over 1,000 and have doubled in the last 7 days. The overall official death toll is moving closer to 2 lakh. Cases in India are growing exponentially at a rate not being seen anywhere else in the world. On an average, nearly 18% of COVID tests conducted in India turn out to be positive. No major country has a positivity rate as high as India. The US, which is the most confirmed infections, has a positivity rate of 7%. Now, Karnataka has become one of the first states to chalk out its plan to buy vaccines. Karnataka's Chief Minister B.S. Yediyurappa has approved the purchase of 1 crore doses of Covishield at a cost price of 400 rupees each in the first phase. The state plans to use the jabs for vaccination of persons between the ages of 18 to 44. Remember, that age group is now eligible for vaccination starting the 1st of May. Joining us now is Mr. Ashwath Narayanan, the Deputy Chief Minister of the Government of Karnataka. Mr. Narayanan, many thanks for joining us here on CNBC TV 18. Appreciate your time. Let me start by asking you about this order that you intend to place with Serum Institute for 1 crore doses of Covishield. By when will you place this order with Serum? Have you had any conversation with the company about this?
I think already the conversation has started since now the government of India has come forward to start the vaccination for the age group between 18 to 44. In this direction, since the vaccination has to start by the May 1st, I think already the process has set in and it's a matter of time. The logistics will start rolling out and we are fully prepared in this direction. Required measures have been taken.
Okay, let me just understand how this is going to work on the 1st of May, because the expectation is, or at least what we've heard from Serum Institute on record, is that they will be able to provide capacity to the private sector and to states closer to the 3rd or the 4th week of May. So come the 1st of May, you will continue to depend on the vaccine that will be provided by the central government. Is that correct?
Yeah, 50% of the vaccination is been provided by for the government, and 50% we need to procure from our side. So in this direction, the above 45 has been provided by Government of India. Anything between 18 to 44 will be provided by state government, and in this direction we have been working. Initially we have started now with 1 crore doses, 1 crore doses of vaccination will be provided. And later on, we need to see how we'll go about it with regard to this matter. So many of the people, many of the companies...
No, but will you be able... Right, but Mr. Narayanan, will you be able to vaccinate people in the ages of 18 to 45, which is what state governments have now been asked to do as per the new policy, starting the 1st of May? That's what I want to understand.
Yeah, 1st of May we are targeted. See, the target, the date has been set from May 1st. Either it can start 1 day later, but the target is to start by May 1st. All the measures or the intention is to start by that. Probably that it goes on, it doesn't happen in 1 day. It will go on for many days. So in this direction, we have been very keen to start on May 1st. Let us see 1 or 2 days here and there if it stays, for any problems or any technical errors. Technical problems, if it starts late, 1 or 2 days. But the intention is to start.
But when will Serum supply to the government of Karnataka, sir? Mr. Narayanan, when will Serum Institute deliver to the government of Karnataka?
Yeah, it will start coming in batches. No, it cannot happen only 1 day. It will come in batches as and when the logistics, the utilization happens, the batch by batch, day by day or week by week, we'll be getting the supply. And now the initiative has started. The further details will be provided. Shortly we'll provide all the details with regard to the has started. The further details will be provided. Shortly we'll provide all the details with regard to the how, when, how many doses, what will happen. We'll give the entire calendar of events, what is going to happen in future.
Are you going to make it available for free as well? The doses, the 1 crore doses that you are going to procure from Serum Institute, will this be provided free to those between the ages of 18 to 45?
Yeah, we are thinking in this direction. In this direction, we are thinking for the people, many of the people will not be affordable. Many of the people, by many of the companies itself, they'll be getting the people vaccinated. We need to work out anyhow. This vaccination has become a topmost priority for the state government. So far, the vaccination has been provided free of cost so far by many of the years. But here, we need to see how things will work out, because the vaccination happens by year, or now it is figured this year what happens. Let us see now. We are keen to do it free of cost, but the numbers, what needs to be done, will work out.
So there is no decision yet on whether the government will provide the vaccine free of cost. You're saying you're keen, but that is not decided so far.
Yeah, the number.
Well, we've lost that line with the Deputy Chief Minister of Karnataka, but some in substance of what he's telling us is that the government of Karnataka will place an order for 1 crore doses of Covishield with Serum Institute. So far, there is no decision on whether this will be provided free of cost to those eligible between the age group of 18 to 45. By the government of Karnataka. A decision on that front is yet to be taken, and there is no clarity yet on when Serum Institute will be able to supply to the government of Karnataka and honour the purchase order as and when a purchase order is in fact inked. Well, 3 scientists at IIT Kanpur have forecast that India's second wave is expected to peak in the middle of May, with daily infection count exceeding 4.2 lakh, provided no new interventions are introduced. In a paper analysing the available data, the trio have found that the pandemic has spread intensely across the country. In fact, India's effective reproduction number, which is the average number of secondary cases per infectious case in a population, started rising in the middle of February, and as of the 19th of April, it stands at 1.37 among other worst-hit countries. In the US, Brazil, effective reproduction numbers now stand at just above the self-sustaining threshold of 1. In France and UK, it's below 1. Looking at India's states, the effective reproduction curve crossed the self-sustaining threshold, first in Maharashtra and about a week later in other states. Recently, Maharashtra and Chhattisgarh have seen a slight decline in this number. However, highly populated states like UP and Bihar, which are some of the least impacted states during the first wave, are in a high growth phase. Joining me now to take the discussion forward, Mahendra K. Verma, Professor of the Department of Physics at the Indian Institute of Technology at Kanpur, Dr. Giridhar Babul, Head of Life Course Epidemiology at the Public Health Foundation of India, and Sarang Deo, the Professor of Operations Management at the Indian School of Business. He's also the Executive Director of the Max Institute of Healthcare Management. Gentlemen, appreciate you joining us here on the program. Mr. Verma, if I could come to you, because governments are looking at the IIT Kanpur models to understand what we can be or should be bracing ourselves for. Now, if things were to continue as is, you're expecting daily infections to cross 4 lakh?
Yes, ma'am. The present last week we had predicted around 3.7 lakhs, but now the revised number is around 4 lakhs per day, which is quite devastating. Indeed, that is what we expect. The peak, yes.
It is devastating, and the case fatality ratio as well. You believe that that is also likely to see a significant spike from where we currently are?
The reason being that once healthcare facilities are full, in fact, we see that there's no bed available in most cities. Villages, of course, unfortunately, there's no medical facility. So people who get infected seriously, even if 99% are getting well by just normal procedure, 1% becomes a large number for 4 lakhs, right? And out of 40,000, that is a large number, and that's I'm sorry, 40,000, 10%, 4,000 is a large number. I think healthcare facilities are going to be overstretched, and that will lead to more deaths and hardship for people. That's what we expect. Yes.
Absolutely. We are seeing a spike in the death toll as well. But you believe that that we'll see a national peak by the second week of May, Mr. Verma?
So these are, madam, our model is not very correct in the sense it is based on SIR model, which is pretty approximate because we are still rising exponentially. Now, because of nonlinearity, when there are more people infected, then the kind of herd, well, it's not herd immunity, but kind of nonlinear community spread appears, and then it deviates from exponential. That has still not come. So our model is approximate only. We expect to be roughly third week of May should go up, but this is a very crude model. So we hope we are getting some approximate number, but yes, it will be maybe around 4 lakhs. I mean, but we can't be definite about it. I must be frank about it.
No, of course, sir. Of course, that is an estimation as per the model that you've put out. But let me get Dr. Giridhar Babu into the conversation. Dr. Babu, many thanks for joining us. And, we were having this conversation on what the R is telling us across different states, and we're yet to see the full impact of many factors and how they're likely to play out in states like West Bengal, Uttar Pradesh, Bihar. Those are the states of concern. What have you observed, especially in the last few days, with the kind of rise in cases that we are seeing?
Yeah, thanks, Irene, for having me on the show. There is a mixed picture that we see in India, right? When Delhi is showing positivity rate of more than 30%, at the same time, the neighboring Uttar Pradesh is not showing similar numbers in terms of the entire state having the positives. Bihar, despite of the effective reproductive number more than 2.5, it is still showing very few number of cases. So the models which IIT folks have presented, or even the other models, are dependent on these reported cases, which takes into consideration what is the remaining population which is susceptible. So therefore, models are as good as the kind of data that is available there. There is skewed skewed data, not in terms of numbers, but also in terms of quality and transparency. The second aspect, Sirin, is the other models maybe the peak will be between 5 lakhs to 8 lakhs, depending on some of the other models. And what would happen is second to third week of May is probably where the peak at the national level is. However, the states will have different peaks. We already see Maharashtra doing well, although they are the early signs of decreasing the burden. But all these models have assumed no intervention. But we know that's not true because Delhi is imposing lockdown. Now probably Bangalore has done half lockdown kind of a situation. We don't know what Uttar Pradesh is going to consider. So these interventions will definitely change when the peak is going to be. And probably it will sort of flatten to a high normal rather than one sharp rise. So we'll have to watch out for those interventions as well.
Yes, those interventions, you're right in pointing out that many states have imposed night lockdowns, weekend curfews, and so on and so forth, and how that's likely to play out. But, 5 lakh to 8 lakh, as Mr. Verma was pointing out, what a devastating number that is, and the impact, the sheer impact of that on the healthcare system, it is nothing short of catastrophic. Sarangvio, let me come to you now with what we should expect realistically on the vaccine front, given the supply situation at this point in time. From the 1st of May, the expectation is that people between the age of 18 to 45 can go out there and get vaccinated. The reality is very different because the supply constraints remain.
Yeah, no, thanks for bringing that up. And to tie it to the conversation so far, if you think about interventions, one of the most potent interventions is vaccination itself. The speed at which we are able to vaccinate the population, along with any curbs and restrictions, should go a long way in bringing down that peak. The problem is, of course, the restricted supply, which is unlikely to change very soon. But as was apparent in the initial conversation you had with Mr. Narayan, there is now added complexity in the supply chain. Serum Institute was selling to one customer effectively so far. Now it would be selling to at least 35 plus states and union territories and private players. So that complicates their operations, complicates which order gets placed when, fulfilled when, which translates into lack of visibility into when the vaccine will be available in which location, which may have an impact on the demand itself, because if people see stockouts, more confusion. And so I think that's the worrying part looking forward in the vaccination front.
Yeah, you're right in pointing that out, because once again, the assumption is that now, ostensibly, since prices have been freed up, that we will now see a ramp up as far as the vaccination program is concerned. But you're right in caveating that this is adding several layers of complexity, and at least on record, Serum Institute has told us that the significant ramp up is only likely to happen post-July. And even when we talk about Bharat Biotech, even their ramp up will take time. So, what should we be mindful of when we talk about the vaccine intervention, Sarangdeo? What is the realistic picture there?
So one thing that probably has not been talked about too much is the expanded eligibility of vaccination. So it's great, that everyone in theory should get vaccine from 1st May. What we've observed looking at the COVID data that's publicly available, the moment eligibility was expanded in April to everyone above 45, we've seen that the increase that was being observed in greater than 60, that increase has diminished. What that means is the more you expand to wider population, people who are most vulnerable and who need the vaccine most, their uptake is actually reducing. So my concern is, while we may vaccinate more people overall starting May and maybe in June, because the total vaccine is limited, the coverage of the most vulnerable and elderly population may get reduced. And those are the people who are, predominantly contributing to hospitalizations and deaths. Of course, younger people are also getting hospitalized. But if I look at the marginal value of one dose, who it should go to, it still is the elderly. And I'm a little concerned if that will get watered down if the eligibility is expanded to the degree we're expanding right now.
Yeah, and I think the other concern or caveat on the table is the fact that of the over 13 crore that have got the inoculation, it's a small number that have got both doses at this point in time. So you need to give the second dose to a large majority of that 13 crore before you exhaust that option, and that needs to be done. But Dr. Babu, you spoke about interventions, and this is something that we've been talking about. And it takes me back to a conversation I had a day or two earlier with Dr. Lakshmi Narayanan, saying that a national lockdown is not an option any longer, and it's not even something that will work necessarily. So if you were to talk about further interventions from here on, including the micro-containment and vaccination, what else can we look at this point in time, given the sharp surge in numbers?
Yeah, so there are three main interventions that we have. Vaccination for sure. But my own firm belief is vaccination is to prevent the mortality and severity of illness in the third wave, not necessarily in the second wave. So third wave presumably somewhere in the winter. So before Diwali, we should be aiming to capture as many as possible for vaccine coverage. So vaccination is for the next wave. For the current wave, we have two main strategies. One is focused and limited mitigation in the form of lockdown at the city level or probably at the district level. Definitely not at the state level, also definitely not at the national level, because it simply does not make sense of applying the same principle the entire country, despite of the transmission being different in different places. Two, the second strategy that we have is effective containment, which should be aggressive. Now, the problem in some of the states is the testing is not really great, and as a result, we might even develop newer variants of concern in those states. So if you do not fix those issues right now, if you do not isolate as many people with the infection as possible, then we might get into some other problem where the newer variants will come, they keep spreading to other states. So these two strategies are very important. Limited lockdown at the city level and aggressive containment for the second wave in terms of reducing the overall fatalities.
Yes, and you're right in pointing out that we need to be mindful of mutants and variants. That double mutant, which we've been talking about for the last several weeks now, there is evidence that there is a new variant, a triple mutant that is now being seen, which we also need more evidence to suggest how it's playing out across India. But Mr. Verma, let me come to you now, and I want to talk to you about the rural spread, because a lot of the attention and the focus in mainstream media is on the metros, on urban cities, etc., and we perhaps haven't understood or fully appreciate the scale of the problem across rural India, which was not so badly impacted in the first wave. What is the data telling you about the rural impact in this wave?
So, we've not looked at in detail the data in villages, because we get only the global count for states, for cities. So district level, but we see from observation, like my own village, I'm told that in Chhattisgarh, there are population of 5,000 and there are 30 odd deaths. So just by observations from people, that's what we saw. In fact, in Kanpur, we are somewhat not in the city, we are slightly away. In the first wave, there was hardly anything in the neighboring village. But now there are a lot of people who are affected by those villages. So this is by observation. Of course, we need more data. And as Dr. Babu said, when we need to do the testing fast. For example, in places we wait for 4 days for testing. And then the people are moving around who are infected. And that is not good actually. I should be, like US, the testing results are available in 4 hours. In some places you are sent somewhere else, in other city, like for example, in Raipur, people are getting test results from Delhi. I think these are delays which we should minimize so that we can get quick results and quick confinement. And these are critical, I think, to engineer. I think Dr. Babu had a very good suggestions that we need to kind of play intelligently if you want to avoid lockdown, and we still can control it or mitigate it. But as I was telling my friends, it's like a fast car going at very fast speed. We can't really slow it down very fast, and that's a worry for me. The numbers were too high, and it just picked up exponentially, and it just goes on. We expect it to basically come out of the exponential, but it is not coming. It is not there yet till today. Yeah. I just hope that we get off the exponential by intelligence. Yes. So that's my view.
That is what all of us are hoping for. That is what all of us are hoping for. But you're absolutely right in pointing out at this point there doesn't seem to be any indication of slowing down the spread. In fact, if anything, it is increasing on a daily basis. But Sarang, to the point that was being made there by Mahendra Verma on testing and the challenges that that's posing, because we're seeing across cities, some cities have actually decided to put a curb on testing. Some cities where testing is happening is seeing a significant backlog in being able to give you results. So how do we address this challenge at scale?
Yeah, thanks for that question, Shireen. And we've been working with a couple of states to ramp up their testing capacity. What we're finding is there is a lot of opportunity, a lot of room on the table to improve. For example, pool testing, where you're not testing individual samples, but you're putting samples together. That helps to enhance the capacity of labs significantly. Not all states are doing it. It requires a bit of retraining of lab personnel, changing the processes, but it can have a significant impact on lab capacity, which can then reduce the turnaround time or the delays. Judicious use of antigen tests prior to RT-PCR tests. We're not saying only do antigen tests, but combine it judiciously in an algorithm with RT-PCR. Again, some of those get done in some districts, in some states, but probably a much more concerted effort, uniform guidelines should help to make the best use of the limited capacity that we have. There are new technologies on the horizon. Some of them are being piloted in small places, but we need to ramp up their adoption and scale up. The costs are not very different. The costs have come down significantly even for RT-PCR compared to the early days of the pandemic. But I think the capacity needs to be ramped up by being, clever and more systematic in the approach.
And pool testing, you believe, is one of the ideas that states should look at taking forward. But, Dr. Babu, I want to come back to you because one of the challenges that we're facing, and that's something that you spoke about, is the quality and transparency of data. Now, if we don't know what we're dealing with, it's going to be hard for us to be able to plan ahead. And that, I imagine, is one of the biggest challenges that we're facing today. So what do you believe needs to be done on that front?
So one of the major challenges, Shireen, is we are actually reviewing the data in a wrong way. I'm very careful in saying that. For example, Delhi reports more cases, they test more, and they demand more oxygen. They make sure that they get all the resources available. That's fine, fantastic. That shows responsive government, good governance, and better systems are in place. You have the neighboring states where people are probably denied testing. There are reports saying that they are not testing and they are being returned. And now, this will worsen the inequities because for a poor person who goes to get tested, we are saying, no, you come tomorrow, let's see if your symptoms disappear. And the person may not come if the respiratory distress sets in between. So where the vulnerabilities are there, we are actually worsening it by actually not reviewing it. So when we review, the management should be looking at why a particular state is not reporting enough number of cases compared to why only a state reports high number of cases. Because those who are reporting high number of cases...
That's an important point that you're making. I'm interrupting here because that's an important point that you're making. You're saying that the narrative is stigmatizing states for reporting higher numbers. That narrative needs to change. If a state is reporting a higher number, but that is also, a state that is testing more than the national average, then that is something that one should support and not stigmatize, because then that's giving you a much more realistic picture on the scale of the problem.
Yeah, and also we miss out on the important aspect when you want to, as you said, stigmatize better reporting. When somebody reports better, then if we subject them, these are the states which have problem, then there is a tendency to probably, reduce the number of tests. I'm not saying it will happen, but generally that's what will happen. Instead, what we should be looking at, why the other states are not reporting as many cases as possible. As a country, why can't we have a standardized rate now? This is the minimum cases that we expect during this transmission season. If we don't get these many, then there is a problem in terms of detection of cases. Why can't we ramp up testing? Why can't we ramp up syndromic approach? So instead of looking there, we will land in more problems, because if these places continue to harbor the virus for longer time, there is higher circulation, there will be higher mortality, and there will be newer variants of concern. So we need to change gears, and also the shift in the direction is needed, Shri.
Yes, we need to change gears and ensure that we are testing more and not stigmatizing the fact that, cases, large number of cases are being reported in a particular state. We need to look at what can curb the spread, what can slow down the spread. That is something that we need to focus on. Mahendra Verma, Girdhar Babu, Sarang Deo, appreciate you joining us here on CNBC TV 18 with your take on how we read the COVID curve for India at this point in time. We'll take a break. There's a lot more coming up. Don't go anywhere. We're back tomorrow.